Hi, I am Dr. Julie Brown, trained concussion doctor and board certified chiropractic neurologist. Today, I don't even know what to title what today's topic is about, but in long, when I take a history on a patient, I try to just take that history that day and be done with it, except for the second visit. Second visit is when I will go over the details of their findings and I relate it back to their symptoms. But the reality is I don't want the patient to live in their symptoms forever. Yes, every time they come in, I want to know if things are better, worse, same, if there's new things coming about. But when it comes to the event or how it's affecting their life, I want them to be heard and seen on the first two visits, but then I try to make it more of a fact versus an emotion of what's going on with them. Because when you have an emotional or limbic aspect to whatever symptom you have going on, my headache, my this, I'm trying to be dramatic. I don't know if I'm doing a good job, but the whole point is when you have an emotional aspect to it, you harden those pathways, you make it very efficient. So you're tying in your emotion with your pain or your head, whatever your symptom may be, you're getting those really efficient at staying around. So the goal is to recognize what's going on, but then move forward, not live in the feeling of it. Hopefully the goal is that we do therapies that naturally want to bring that down and you won't be as attached to what's going on. But I do have some people that are definitely more limbic and emotionally tied into what's going on with them. Yes, you can have PTSD. Yes, going to doctors is not fun. I agree with all of that. But the goal really is to get away from it. When I think of talk therapy, same thing goes with talk therapy. You shouldn't be in there discussing the same thing over and over and over and how it makes you feel over and over again. You really got to move on. Okay, I feel that way, but now what? How do I move forward from this? When it comes to something like a concussion or a car accident, man, I talked to a woman in the sauna the other day. I think she had a car accident definitely 20 plus years ago, and she still doesn't drive and is afraid to go outside of her little neighborhood. Those are things that really need to be addressed. But when those events happen, you do get a limbic response. You get epinephrine, you get this stimulus to the brain that says, hey, something's not right here. And it makes those pathways very efficient because it says, I want to remember in the future when any of these things come about, I'm in danger. So then you go out into your real world and you may perceive things as danger that are not really danger. And you have an limbic and an emotional response to it. When it comes to therapy, I can't compete with that emotionality. I may try. I'm pretty dry and sarcastic, so I say things sometimes that are funny, and I'm like, oh yeah, that was funny. And I realize I'm doing that to naturally get a limbic response out of the patient, to make it lighter, to laugh, to do something. And the whole goal, I can't compete with the traumatic hormonal response that happens in an event. So it takes repetition of doing exercises to make the other pathways come around, to make the networks work that can help calm you down. We have different networks and how different parts of the brain talk to each other. And you can be stuck in one because these other pathways have been, for lack of a better word, shut off, or they are not used as much because you're stuck in this intense protection pathway. So in short, try not to be super emotional about what's going on with you, though it may feel emotional, and it is. It's not to negate whatever symptoms are going on. But once you acknowledge what's going on, we got to move forward. When it comes to follow-up visits, yes, I ask. I need to know, do you still have the headache? Is the intensity still the same? Is the frequency still the same? There are things that I need to know, and I know people are getting better when they can't remember. So I know that we're starting to make changes. But overall, don't get emotionally attached to what's going on with you. And to give a little forgiveness for the people who are emotionally attached. It can be indicative from a clinical aspect that maybe your frontal lobe is not doing as well. Because one of the things that the frontal lobe does is when there's activity, it calms down what's called the amygdala. And that amygdala is more of the lizard brain, the primitive response to protect. And it could be diagnostic for me if somebody's so emotionally attached to it. Hey, their frontal lobe is not firing networks appropriately to help calm them down. So it could be diagnostic as well. Anyway, if you have any questions, feel free to leave something in the comments, and we'll see you next time.